आपको विमेन्स हेल्थ केयर के बारे में अभी की कंडीशन क्या लग रही है?
वी हैव अ लॉन्ग माइल टू गो इंडिया. अगर कुछ तबका देखा जाए समाज का जिसमें विमेन्स हेल्थ को इतना प्रायोरिटाइज नहीं किया जाता. व्हेन इट कम्स टू अ वुमन, वो कितना भी पेन में रहो तो उसको साइकोलॉजिकल पेन बोला जाता है या फिर निग्लेक्ट किया जाता है कि ठीक है तेरा तो रोज का ही है, बाद में देखेंगे. या फिर ऐसे उस पर अगर एक्सपेंडिचर की बात आए तो जैसे मेल पेशेंट को कहा जाएगा कि कितने भी पैसे लगो ये ठीक होना चाहिए, ऐसा सीनरियो कुछ फीमेल के बारे में नहीं देखने को मिलता है.
Wow.
So we need to change this attitude of ours.
I mean, what is the maximum surgeries you did in a day?
15.
15. You've achieved so much already. What is the next for both professional and personally in your life?
Basically, my dream would be spreading Matrutvam hospital's idea in all the districts of Maharashtra.
Okay.
Because I think in every other district, all the consultants and the gynecologists should come together. They should build a setup like this, and they should do a collaborative practice, and they should give patient the best service available. That experience I can't put in word, but वो experience बहुत ज़्यादा heart touching, और वहाँ हमें ये proud feeling आता है कि thank God I am a doctor, I can save lives. And वो जिंदगी मैंने बचाई. Whenever you consider that you are successful, that time you understand that you are just a puppet. Everything is done by some supernatural power.
Hi, welcome to Decoded by Neel, and today I have a guest who has literally brought thousands of lives in this world. And with over 3,000 deliveries and 18,000 plus laparoscopic surgeries, we have Dr. Pankaj Mate. Dr. Pankaj is not just a gynecologist, he's also awarded the youngest hysteroscopic award as well as an Economic Times Award of Laparoscopic Surgeon of the Year. He's not just a gynecologist, but he's also a traveler and a bird photographer and also a documenter on wildlife. Let's explore and let's decode the life of a gynecologist, endoscopic surgeon, and founder of India's first women's multi-specialty hospital. Welcome, Dr. Pankaj, on the show.
Thank you.
Okay. So tell me about how you started the journey of becoming or thinking about gynecology.
Basically, what happened? My both parents were doctor. My father used to do general practice, and my mother used to do gynec practice. So my parents were my major inspiration from childhood.
Right.
That I should come into this profession and help people out.
But don't you think that it was myth before that male coming into gynecology is little bit awkward? आपके टाइम पे कैसा था?
Basically, as you can see. जहाँ भी आप कौन सा भी फील्ड देखोगे तो मास्टर शेफ हो या फिर गायनेकोलॉजी हो या फिर कोई भी फील्ड हो जहाँ हम ऐसा कंपैरिजन करते हैं कि मेल और फीमेल, वहाँ अच्छे खासे मेल भी अच्छा परफॉर्म कर रहे हैं. सो आई हैड दैट चांस, सो आई ऑप्टेड आउट फॉर गायनेकोलॉजी.
दैट्स ग्रेट. मैं हमेशा देखता हूँ कि डॉक्टर इतने साल पढ़ाई करता है तो हमारा इंटरनल जोक है कि वो 12 साल के वनवास पे जाते हैं और उसके बाद बाहर आते हैं. व्हाट डू यू थिंक अबाउट दैट एंड हाउ व्हाई डिड यू चूज कि 12 साल का वनवास मेरे को करना है?
Basically, it was a long journey. We had to complete our MBBS education first, then we had to go for internship, then again we have to prepare for our PG examinations, and then after finishing PGs, we need to focus on some specific area. Like suppose I have done my fellowship and expertise in laparoscopy. Some people do in infertility IVF. There are so many subspecialties where people get trained. So it took 12 years, 13 years almost to complete me that education.
So where all did you do education and what experience you have had?
Okay. I completed my MBBS from Mymar Medical College, Talegaon, Dabade, near Pune. Then I did my UG PG, means undergraduation and post-graduation there. And then I went to Dr. Hafiz Rahman sir's Sunrise Hospital in Cochin. There I completed my laparoscopy fellowship. Then I again did advanced laparoscopy fellowship with Dr. Shailesh Puntambekar sir in Galaxy Hospital, Karve Road, Pune.
Right.
And after achieving couple of months experience in this field, I started my own practice in Nagar as well as in Pune.
You also, from what I've read, you have also done, you have also worked Indian and internationally, right?
Right.
So, what do you think is the difference that you have had in experiences in healthcare?
Basically, अगर हम देखना चाहे तो जो अब्रॉड का सिनारियो है, जहाँ इफ़ वी कंपेयर विथ यूएस और यूके, वहाँ डेटा बेस्ड स्टडी एंड प्रोटोकॉल बेस्ड ट्रीटमेंट बहुत ज़्यादा है. बट एज फार एज इंडिया इज कंसर्न, यहाँ बहुत सारा वेरिएशन है क्लास में. सो यू नीड टू बी वेरी प्रैक्टिकल एंड रिसोर्स कभी कभी जो अपने हाथ में है उनको ध्यान में रखते हुए यू नीड टू डिजाइन द ट्रीटमेंट. सो इट नॉट बी अ सेम ट्रीटमेंट implemented in a metropolitan city as well as in a rural area. You need to define those things.
अभी तक जो आपने 18,000 लैप्रोस्कोपिक सर्जरीज की है, 3,000 प्लस गायनेकोलॉजी आपने बेबीज डिलीवर किए हैं,
Right.
उसमें आपको एक सिग्निफिकेंट मोमेंट कौन सा था व्हिच यू थॉट दिस वाज एन अचीवमेंट दैट आई हैड थॉट व्हेन आई वाज स्टडीइंग फॉर 12 years?
Basically, whenever it comes a point के some patients are very critical, they are about to lose their life, and when we save them, that time you really get that experience. I can't put it in word, but वो experience बहुत ज़्यादा heart touching, और वहाँ हमें ये proud feeling आता है कि thank God I am a doctor, I can save lives, and वो जिंदगी मैंने बचाई.
Just to give a hint that I mentioned in the earlier introduction that he's coming up with the women's first multi-specialty hospital. आपको women's healthcare के बारे में अभी की condition क्या लग रही है?
We have a long mile to go, India per se, because अभी भी women's health sector जो है उतना develop नहीं है, या फिर हम अभी भी अगर कुछ तबका देखा जाए समाज का जिसमें विमेंस हेल्थ को इतना प्रायोरिटाइज नहीं किया जाता. आई जस्ट गिव वन एग्जांपल. देयर इज वन ऑफ माय फ्रेंड्स हु इज अ यूरो सर्जन. मोस्टली वहाँ जब एक मेल पेशेंट को यूरिनरी स्टोन होता है, किडनी स्टोन होता है, एंड दैट मेल पेशेंट इज इन एगोनी, वेरी मच इन पेन, तो वो पूरा परिवार उसको सेंटर में रखते हुए उसके लिए कितना भी पैसा खर्च हो, उसको ट्रीटमेंट मिलनी चाहिए, उसको क्विकली आप पेन से रिलीज करो, ये उनका सबका अप्रोच रहता है, बिकॉज ही इज द हेड ऑफ द फैमिली, इसलिए उसको ऐसा इतना तवज्जो दिया जाता है. बट व्हेन इट कम्स टू अ वुमन, वो कितना भी पेन में रहो तो उसको साइकोलॉजिकल पेन बोला जाता है, या फिर निग्लेक्ट किया जाता है कि ठीक है तेरा तो रोज का ही है, बाद में देखेंगे, या फिर ऐसे उस पर अगर एक्सपेंडिचर की बात आए तो जैसे मेल पेशेंट को कहा जाएगा कि कितने भी पैसे लगो ये ठीक होना चाहिए, वैसा सिनेरियो कुछ फीमेल के बारे में नहीं देखने को मिलता है. So we need to change this attitude of us.
That's a great idea. And talking about your specialities about laparoscopy and gynecology, any special advice that you want to give to a woman who is experiencing some kind of pain, but जो आपने बोला अभी कि वो एक प्रायोरिटी घर वाले नहीं दे पाते, any suggestions that you have for that female or the person or the head of the family?
No symptom should be neglected. Whenever you feel there is something wrong, or you're having a bit of pain which is unbearable, or any other health issue, you should talk to your partner or your mother, father very openly, and you should consult a doctor whenever it is possible, as soon as possible.
Gynecology सबको पता है, but जो laparoscopy है वो बहुत लोगों को पता नहीं है. So can you explain in detail, in layman terms maybe?
Okay. Initially मैं just आपको एक example देता हूँ. Laparoscopy start हुआ वैसे एक 1990 से उसको ज़रा पिकअप मिलना चालू हुआ, बट मेजर रिफॉर्मेशन और उसमें इंस्ट्रूमेंटेशन, हायर एडवांस इंस्ट्रूमेंटेशन, ये सब 2005-2010 से ज़्यादा हुआ. तो अभी ऐसा नहीं है कि लोगों को लैप्रोस्कोपी पता नहीं है, बट उसका इनिशियल स्टेज में जितना हमें बोलना पड़ता था कि लैप्रोस्कोपी इज एडवांटेजेस क्या है, वो मिनिमल इन्वेजिव है, बड़ा ऑपरेशन नहीं लगता, पेट फाड़ना नहीं लगता, ये अभी लोगों को धीरे धीरे समझ में आ रहा है, और लोग पीपल आर शिफ्टिंग ऑन टुवर्ड्स लैप्रोस्कोपी मोर देन ओपन सर्जरीज. उसमें एक बेस्ट एग्जांपल मैं बोलता हूँ आपको. इनिशियल डेज में व्हेन आई स्टार्टेड माय प्रैक्टिस, my sister came to me, a distant relative, and she had some uterus problem. I had to remove her uterus. So laparoscopy का एडवांटेज ऐसा है कि पेशेंट इज वेरी मच अर्ली डिस्चार्ज. मतलब अभी मैंने मॉर्निंग में ऑपरेट किया, नेक्स्ट डे मॉर्निंग शी वाज डिस्चार्ज. आफ्टर 2 days she came back. So I thought there might be some problem with surgery. She might be having some bleeding or some
right.
issue must be there.
Right.
So I said, how are you? She said, I'm good. So I said, why did you come back very early? So she said, ke everybody is saying you're discharged within 1 day.
Right.
It seems that you haven't been operated. You're just given anesthesia. They kept you in hospital and they discharged you. This was the literal scenario.
Oh.
Then I had to send her to a radiologist, where I make him do her ultrasound and
confirm.
He counseled her that there is no uterus seen. The operation has been performed. And don't worry, everything is fine.
So तब से चालू है कि यार मिनिमल इन्वेसिव सर्जरी.
तो ये सिनारियो से व्हेन वी स्टार्टेड कि लोगों को थोड़ा विश्वास नहीं बैठता था मिनिमल इन्वेसिव सर्जरी क्या है, इतनी जल्दी डिस्चार्ज हो सकता है, इतनी जल्दी रिकवरी हो सकता है. वो स्टेज से आज ऐसा सिनारियो है कि हमें बोलना भी नहीं पड़ता. काउंसलिंग करने से पहले ही पेशेंट बोलता है मतलब आज शाम को छुट्टी हो जाएगी ना ऑपरेट करके. सो वी हैव ट्रैवल्ड दैट मच ऑफ डिस्टेंस.
सो माइंडसेट तो चेंज हुआ
है 100%.
राइट. But working, so coming from this background, and you know, in our conversation before, you said कि only 1 in 10 does laparoscopic surgery, laparoscopic surgeon होता है. उसके बारे में थोड़ा बताइए कि लोग क्यों ऑप्ट नहीं करते या इसका स्पेशलाइजेशन क्यों अच्छा है.
तो बेसिकली व्हेन आई वाज डूइंग माय पीजी, वो टाइम पे सिनारियो ऐसा था कि लैप्रोस्कोप्स वगैरह मेडिकल कॉलेज में अवेलेबल नहीं थे. So after completing your 3 years of post graduation, you need to go for a fellowship where जहाँ आपको लैप्रोस्कोपी सिखाया जाता था.
Right.
So after completing 3 years, बहुत सारे पीजी स्टूडेंट्स ये ऑप्ट नहीं करते थे कि एक्स्ट्रा टाइम अभी कौन जाएगा, हमें अभी प्रैक्टिस चालू करना है. वी आर स्टडिंग सिंस सो मेनी इयर्स, सो वी विल स्टार्ट प्रैक्टिसिंग एंड लेटर वी कैन सी वी कैन डू अ फेलोशिप मीन ड्यूरिंग आवर प्राइवेट प्रैक्टिस. बट वो होता नहीं था.
Right.
एंड वंस दो वो उन्होंने प्रैक्टिस चालू कर दिया तो दे वर एनग्रॉस्ड इन देयर प्रैक्टिस एंड देयर वाज नो टाइम फॉर देम टू गो एंड स्टडी लैप्रोस्कोपी.
करेक्ट.
सो इस सिनारियो में जिन लोगों ने शुरुआत में ही बिफोर स्टार्टिंग प्राइवेट प्रैक्टिस लैप्रोस्कोपी सीखा और वो आए और उन्होंने लैप्रोस्कोप सेट खरीद के लैप्रोस्कोपी चालू किया, उन लोगों को ज्यादा एडवांटेज मिला. Now that scenario is changing. Now many of the new students and gynecologists are learning laparoscopy and starting their practice now.
कितने पेशेंट्स अभी आपको लगता है कि कितने फीमेल्स knows about laparoscopy? How many percentage? अंदाज़े, just your ballpoint.
If we consider urban India तो almost सबको अभी पता है. Rural India में थोड़ा सा और भी उसकी जानकारी कम है.
You won youngest hysteroscopic award in 2016, right. And you also won AIMS Top Gun award.
Right.
What changed after you got those awards? I mean, is there be betterment या फिर recognition? क्या हुआ after those awards?
It is always it is a proud moment to win an award. बट सेकेंडली क्या होता है बेसिकली आप जो हार्ड वर्क कर रहे हैं उसको अप्रिसिएशन मिला तो यू गेट मोर एनर्जी एंड चालना मिलती है आपको कि और आप अच्छा करें और बेटर ट्रीटमेंट पेशेंट को प्रोवाइड करें और कुछ एडवांसमेंट उसमें लाए. सो इट हेल्प्स यू इन ग्रोइंग योर प्रैक्टिस एज वेल एज योर ओन स्किल्स.
Before, we were discussing that before he thought of having a multi-specialty women-centric hospital, he's just stopped practicing for Pune region.
Right.
And just out of curiosity, I want to tell you that women used to wait for this surgeries to happen because he was the best in class, right? So, any case that you remember which was very urgent, and what happened in that?
I remember one case where a patient was Scottish in origin and she was in London, and she was air hostess there in London, airlines.
Right.
So she flew, she came to Pune for her treatment, infertility treatment, and I had to do her operative. After that she went back to London and she conceived.
Oh.
Yes.
So London ka baby aapne deliver kiya ideally. almost 3,000 deliveries आपने की है, right? And there may be multiple pregnant ladies that may be seeing this podcast. Any word of advice on what kind of things to look at? There are 3 trimesters. That's what we spoke about.
Right.
Any what should you do in all the 3 trimesters?
Basically, if you have already conceived, then first and foremost thing is you should consult an obstetrician, where you should enroll your name and timely ultrasounds. Then whatever medications you have been advised, you should take those medicines. And whenever you feel something is not right, you should consult your obstetrician immediately, because pregnancy is one thing where there are so many chances of morbidity and mortality. So you should keep those things in mind. So never ever take things for granted. Do not listen to your friends. Do not go on to social media or any Google and take advice from those websites or something like that.
Right.
You should always consult your obstetrician and you should listen to them, because every doctor, whoever you are opting, has a good experience in it and you should trust them.
Any word of advice that you want to give on each trimester on things that they should do?
In first trimester, I would say that fetus takes some time to nicely get implanted and chances of abortion are more in first trimester. So you should take care and you should not lift heavy weights and you should not travel. In second trimester, you should start doing few regular homework. In third trimester, you need to be very careful, as sometimes you may land up in premature labor. So that trimester is also trimester also requires a nice rest as well.
We just talked about 3 trimesters. What about people who are trying to conceive? Right. So right now, with the fast-paced life, everyone working, both couple working, people not having babies before 25 or before 27. What is your checklist for them?
I would just like to advise in this case that basically what is happening in this fast life, couple are not giving very much needed time for
Each other. Right.
Your relationship should blossom and you should definitely take out some time for your hobbies and you should be relaxed. Work stress should be less. You should give ample of time to your partner, and conception should not be taken as a task. That should not be taken as a target. You should enjoy that process and you should be very stress free and do not plan too much. It will happen by its course.
You spoke about planning and you spoke about a stress. I mean, what is the maximum surgeries you did in a day?
15.
15
in a day, yes.
And what was the mindset after that?
Nothing. I love my work. So it is never like that, oh, itna kaam karna hai. Nothing like that. I enjoy my work. Whenever I finish my work, I just need a tea. That's all.
We'll get your tea soon. Let's hit the part of your life and personal life segment on your early life, your family, your inspiration, right? So, how was the role of your family, your wife during your career? Talk to me about that.
Okay. So to start with, I was very average student. Even during my school age and during my college, I was an average student. But I would like to stress that if you work really very hard and if you are focused, then nothing is impossible. Because being an average student, I was very much focused that I want to do and pursue a laparoscopic training. So I did that. Then I became a good laparoscopic surgeon. Then I was doing a good work, so I started fellowship programs under me where I train other doctors in laparoscopy.
Wow.
So if you are persistent, if you're committed, if you're focused, then everything is possible. Second thing, my family supported me very nicely through my journey. Whenever there were ups and downs, they were always supportive to me. And my wife, my parents, and now my kids, everybody supports me.
Any incident in the early marriage that you were, any incident that you got that your wife were extreme supportive? Do you recall any incident?
I would say that her support is seen in her behaviors. Just like that, I used to start my day at 6 o'clock in the morning. So she used to get up at 5 and prepare me breakfast so that I need not have to do my breakfast outside in some hotel or some unhealthy place. So she used to wake up at 5 and prepare me breakfast and hand over the tiffin to me. She never complained that I'm operating for the whole day and I did not spare some time for her. That was never a complaint. And this, in a way, helps us to work more and work more hard and provide them the life they deserve.
Right. Absolutely, stay motivated. I believe wife is always a supportive and backbone of whatever you do in life, personal or professional. And any experience with any other person or a doctor outside your family that supported you in a going next level that you think of?
Basically, I would like to take or mention the names of my guides. Basically, Dr. Mohan Sari, Dr. R.D. Kulkarni, Dr. Hafiz Rahman, and Dr. Shailesh Punthamekar. These 4 people have a very big impact on my career, my life, and as a person I am. So these people always motivated me that nothing is impossible, anything can be achieved. And after seeing them, I always thought के ये कर सकते तो मैं क्यों नहीं, and that helped me a lot. So I was able to do good in laparoscopy as well as in obstetrics.
और कोई ऐसा एक पर्टिकुलर किस्सा जो याद आ रहा है इन चारों गाइड्स से, चारों मेंटोर से आपके लाइफ में?
I would like to give one example. Once I was doing my one gynecology term with Dr. R.D. Kulkarni sir, Ravindra Kulkarni. He practices in Bosri. So in his hospital, one patient came and she was torrentially bleeding. And she was almost full-term pregnant and she fell down in the gate of the hospital.
Oh.
So he just ran, he lifted her up like this and went to OT.
Okay.
There was no time to give her anesthesia. She would have died because of the torrential bleeding. So he, without giving her anesthesia, the general anesthesia or spinal anesthesia, he just gave her a local anesthesia, that is just locally infiltrating anesthesia and taking skin incision, opening the abdomen, opening the uterus, and he took the baby out.
Shit.
Because that moment was so crucial, everything should have been done in 5 to 10 minutes. And he did that and he saved her life.
Oh, that must be quite thrilling to watch.
Thrilling, and that gave the importance of time in medical field. How much important every second is.
I mean, even 1 second split here or there and you're playing with the life.
Very deadly situation for that patient.
अगर लोग डॉक्टर ने बचाया तो वो भगवान, नहीं तो वो शैतान, ऐसा बोला जाता है.
That is, I would say, अच्छी बात नहीं है. People should also understand कि
सब कुछ हाथ में नहीं है.
Everything is not in doctor's hand, and they try their level best.
100%. No, I still believe doctors are an integral part of one's life because they are at the worst moment of your life.
Correct.
And आप best में कभी नहीं आते हो डॉक्टर के पास, आप हमेशा worst में ही आते हो.
And we too need help of God. Always we pray in mind कि ठीक होने दो भगवान, ये surgery मैं कर रहा हूँ, ये difficult है, please help me. Everything should go smooth and fine. That patient should get recovered and that life should be saved.
Let's talk about your spiritual journey now, right? So, you just mentioned about Bhagwan and unka role. So, talk to me about what is the spiritual angle on being a doctor. या आप क्या क्या करते हो?
I think when you come to a stage where you become successful, or whatever the definition of success is different for everybody. But whenever you consider that you are successful, that time you understand that you are just a puppet. Everything is done by some supernatural power.
So we are still living in Matrix.
Matrix, right. So जो हम कर रहे हैं, मैं ये करूँगा, मैं वो करूँगा, ऐसे कुछ नहीं रहता.
चीजें होते जाती हैं.
God makes you do that. Just you should be true to your work. Then He helps you out to get a successful life.
But what about एनी इंस्पिरेशन स्पिरिचुअलिटी जिससे आप इतना डिसिप्लिन्ड हो गए लाइफ में?
My health issue when I suffered a severe myocardial infarction, that is heart attack, 1 year back, and I had a cardiac arrest, and then I was revived by Dr. Sandeep Gade, a very well-known cardiologist, and I was put 3 stents in my heart. After that, my perspective towards life is completely changed now. I'm very much thankful to God because God has given me second life.
Absolutely.
I could not ask anything more from Him now.
नहीं, और पैसा भी नहीं चाहिए, कुछ नहीं चाहिए, हेल्थ चाहिए बस.
Health is also important, but I had a strong family history, so I had to face that. But that's fine.
And
That is part and
parcel of family.
But bouncing back, coming against all the odds, that is important. And if your willpower is good, and if you fight back nicely, then always God will stand behind you and help you out.
Can you tell me about those 2.5 minutes you were talking about?
At a certain point, I felt that I am not going to live. So even at that moment, I told my cardiologist that I don't think I'll make it. I'm losing everything now. My consciousness I was becoming unconscious, and that time I felt that I'm going to die. But everything in my life flashed in front of my eyes, and I thought that I have done a good job. I have saved lives. I have done hard work. I have given everything to my family and my kids. So if this is the fate, then I'm ready to accept it. And अब जाना है तो जाना है.
You were given 8 times, right?
8 times I was given defibrillator shock, and after 8th shock I was revived back to life.
Generally 3 देते हैं.
Generally 2-4 में patient अगर नहीं बचा तो continue नहीं करते हैं. But my cardiologist never gave up on me.
That's a good thing.
This is because of him I'm sitting here and talking to you.
Kudos to them.
Yes.
उनको हिचकी लग रही रहेगी, but फिर भी. Let's explore a different part of your life, which is traveling and photography. You've traveled Lakshadweep and Bali, Leh Ladakh, बहुत कुछ गए हो.
Right.
And you have your own channel also where you podcast.
Yes.
So let's explore that angle and tell us, what all has changed between practice and travel.
Basically, I would say that traveling helps you to grow as a person. The more culture, the more people you see, the more different cultures you learn, that will help you grow as a person. That is very much important, because हम क्या होता है basically day to day life में we get stuck in a particular
rut.
वही routine बन जाता है.
Correct.
And the people which are around us, we think कि यही life है, वो norms पे comparison होना चालू हो जाता है. Whenever you travel, you go distant places, you meet different people, you socialize, then you understand that नहीं यार, इससे भी परे बहुत सारा जीना बाकी है, इससे भी परे बहुत सारा life है. So it helps you grow as a person.
Any particular incident that influenced your life significantly, because you spoke about tribes and बहुत अलग-अलग चीजें हैं travel में.
Basically, few people I have seen during traveling, they are very much successful. Still, they were so much humble. They were very helpful. That taught me a lot, because whatever you achieve in life, you should be very grounded. And
कोई पर्टिकुलर किस्सा याद आ रहा है?
ऐसे तो अभी बोलना मुश्किल है.
जो आप ट्रैवल कर रहे हो, प्लेसेस जा रहे हो, तो वहां पे जब ट्रैवल के लिए जा रहे हो, या कभी कभी ऐसे लगता है कि यार थोड़े हेल्थ केयर का भी और थोड़ा देख लूं यहाँ पे क्या चल रहा है? Have you seen any scenarios particular to that?
Nothing like that, because India is a vast country, and even if you travel to distant places, हर एक सेक्टर का हेल्थ सिनारियो, वहाँ का इंफ्रास्ट्रक्चर हेल्थ का टोटली डिफरेंट है. सो यू कैनॉट कंपेयर. हम यहाँ पे अगर कहाँ नॉर्थ में जा रहे हैं तो साउथ का अलग है, साउथ में जा रहे हैं तो ईस्ट का अलग है. सो यू कुड नॉट कंपेयर दैट. बट एज अ मतलब whenever you need a break from your hectic schedule, travel helps. It acts like a rejuvenation and therapy for your mind.
Fair enough. When we talk about cultural differences, right? ऐसे बहुत बार होता है कि वो अभी भी बहुत सारी फैमिलीज ऐसी है बहुत गांव में तालुका लेवल पे कि उनको अभी भी पुराने समय के जो हेल्थ केयर है या फिर वहाँ की जो फैसिलिटीज है उनका बहुत अच्छा बिलीफ है. तो फॉर एग्जांपल जैसे वाटर बेबी होता था पहले,
Right.
या फिर जो भी अलग अलग प्रोसीजर्स होती थी विच मे और मे नॉट बी इन गुड फॉर्म और शेप, नो ऑफेंस टू एनीवन, बट उसके बारे में क्या ख्यालात है आपके?
नहीं, बेसिकली टाइम हैज चेंज अ लॉट एंड अभी हेल्थ सेक्टर भी बहुत ज़्यादा एडवांस हो रहा है इंडिया में. इवन रूरल प्लेसेस में भी अभी पेनिट्रेशन हेल्थ केयर का बहुत अच्छा है, वहाँ भी अच्छे हॉस्पिटल्स ओपन हो रहे हैं एंड मॉडर्न टेक्नोलॉजी वहाँ तक केटर करने की कोशिश गवर्नमेंट एज वेल एज प्राइवेट सेक्टर भी कर रहे हैं. सो पुराना सिस्टम जो था तो ऑलमोस्ट आई वुड से कि अभी बहुत कम जगह पे वो बचा रहेगा.
So from working with multiple hospitals and now thinking of an idea of a first women's multi-specialty hospital, how did this idea come into picture and why?
Basically, what happened, being a gynecologist, in due course, I got very much familiar with the problems which Indian women are facing. So we thought that there are so many fronts. As far as the delivery and baby is concerned, there are nursing homes where especially women are catered. But when it comes to other surgeries, other pathies, like say ophthalma, medicine, kidney surgeries, plastic surgeries, oncosurgeries, there they do not have a special separate hospital for them, where only female can be treated and where they get the environment where female staff is there, female residents are there, female doctors are there. They are not, they don't have that privilege. So we came up with the idea that why not to build a multi-specialty hospital where every other staff is female and all the female patients should get A to Z all the treatment modalities under one roof.
अभी जो मल्टी स्पेशलिटी हॉस्पिटल्स हैं इन द पिक्चर इन एरिया इन इंडिया वेरेवर, ऐसे कौन से डिसीजेस है विच वुमेन फील यार ये तो फीमेल से ही हैंडल होना चाहिए, बिकॉज ऑफ विच मल्टी स्पेशलिटी ऑफ वुमेन सेंट्रिक हॉस्पिटल केम इनटू पिक्चर?
There are many surgeries, like there are breast surgeries,
right?
There are cancer surgeries, there are few cosmetic gynecology surgeries which should only be done in
women centric
hospital.
And ये first time in India होने वाला है.
First time in India होने वाला है because we have that conception in our mind that women's hospital means mother and child. We do not go beyond that.
Right.
So beyond that there are so many diseases and pathies where different consultants are needed and different treatment modalities should be available in that particular hospital that should only cater female patients.
We wrote so just a background about the manifesto. When we started having a conversation on working on this first women's multi-speciality hospital, me, my team, everyone was sitting together कि इसको कैसे लोगों को बोले कि इट इज नॉट जस्ट अबाउट गायनेकोलॉजी. और डॉक्टर वही कह रहे थे कि हमारे पास इतने स्पेशलिटीज है, बिकॉज मल्टी स्पेशलिटी इज एक्चुअली मल्टी स्पेशलिटी एंड फर्स्ट टाइम इन इंडिया जहाँ पे इतने सारे डॉक्टर्स एक साथ आके स्पेशलाइज्ड ट्रीटमेंट हर एक के लिए कर रहे हैं. तो जब हमारी टीम ने काम चालू किया तक मैनिफेस्टो बिल्ड हुआ विच इज इन मराठी दैट ही विल स्पीक राइट नाउ. And very powerful manifesto which his team everyone liked and he liked so much. Now he'll read on that.
Sure. So it says स्त्रिया दुर्गा आहेत, लक्ष्मी आहेत, सरस्वती आहेत, पण आरोग्यासाठी ज्यांना अजूनही वाट पाहावी लागते, घरात सगळ्यांच्या तब्येतीकडे लक्ष देणारी ती स्वतःच्या तब्येतीच्या बाबतीत नेहमीच मागे राहते. बाळाच्या जन्मापासून ते वृद्धत्वाच्या प्रवासापर्यंत तिच्या आरोग्याची जबाबदारी कोणी घ्यायची? उत्तर एकच आहे, मातृत्व. इथे मातृत्व केवळ नाती सांगत नाही तर उपचारही देते. इथे डॉक्टर फक्त पेशंट तपासत नाहीत तर कुटुंबातील व्यक्तीसारखं त्यांची काळजीही घेतात, मुलगी असो, आई असो किंवा पत्नी. स्त्रीच्या प्रत्येक टप्प्यावर तिच्या प्रत्येक गरजेसाठी आम्ही उभे आहोत. जन्म देण्यापासून ते नव्या आयुष्याची सुरुवात करण्यापर्यंत आई होण्यापासून ते स्वतःच्या तब्येतीची जबाबदारी पूर्णपणे पार पाडण्यापर्यंत स्त्रीच्या आरोग्यासाठी इथे फक्त उपचार नाहीत तर संपूर्ण काळजी आहे. मातृत्व प्रत्येक स्त्रीसाठी प्रत्येक क्षणी.
Thank you so much. How did you find about the manifesto? क्या लगा
It's great. Manifesto खूप छान आहे. Absolutely, it is wonderful and it has covered everything regarding the life journey of a particular female, I would say.
Correct. When we were also thinking about कि यार जब एक फर्स्ट टाइम इन इंडिया आ रहा है तो उसको इतना जबरदस्त प्रिपेयर करो कि उसके बाद कुछ भी हो जाए वो वही रहेगा. ओके. मल्टी स्पेशलिटी हॉस्पिटल जो हमने विमेंस के लिए स्पेसिफिक किया है विच इज फर्स्ट टाइम इन इंडिया, ये क्यों करना जरूरी लगा आपको? एंड इसको विमेंस को तो बेनिफिट डेफिनेटली है बिकॉज इट इज ऑपरेटेड बाय फीमेल्स एंड स्पेशलाइज्ड बाय फीमेल्स इटसेल्फ, बट डॉक्टर्स का क्या बेनिफिट है इसमें?
वेरी गुड क्वेश्चन. तो इसमें क्या है बेसिकली कि इट इज फर्स्ट टाइम इन इंडिया we almost 40 of the gynecologists are coming together and developing this type of concept where we are promoting collaborative practice. Generally क्या होता है कि individual doctor will thrive for doing his or own hospital एंड वो हॉस्पिटल का इन्वेस्टमेंट, उसको जो लगने वाली सब चीज़ें हैं और जो फंडिंग है या फिर जो भी रिसोर्सेस उनको अवेलेबल करने हैं, इट इज़ वेरी मच फ्रस्ट्रेटिंग फॉर अ सिंगल डॉक्टर टू मैनेज everything. So what we have designed a pattern where all the youngsters, middle-aged practitioners and senior people should come together. They should work under one roof, and that particular hospital should have every other damn facility available, that too in a negligible shareholding amount.
Right.
So these doctors will benefit that they are going to use or cater their service in such kind of hospital where there are top-notch instruments and facility available for patients. Second thing, they need not fight with corporate setups because this is a kind of corporate setup which we are building for the doctors.
So it is not a one person running the organization, it is doctor running with each other.
Yes.
So it's a collaborative effort. बहुत यूनिक है क्योंकि मैंने भी अभी तक जितने कॉर्पोरेट सेटअप्स देखे हैं, जितने भी हॉस्पिटल्स देखे, इट इज नॉट रन बाय डॉक्टर्स. आपने एक बीच में बहुत अच्छी बात कही थी जब व्हेन वी वर डिस्कसिंग बिफोर कि आजकल कंटेंट क्रिएटर्स हेल्थ केयर से ज्यादा पैसा कमा रहे हैं देन डॉक्टर्स. कैन यू एक्सप्लेन अबाउट दैट?
This is a practical scenario where everybody knows that nowadays the one content creator who is famous on social media makes a huge amount of money as compared to doctors as well. We are getting underpaid.
जो मतलब 12 साल का वनवास के बाद भी underpaid हो रहा है.
Right, very true.
That's very interesting. Let's move to a very fun round, which is a rapid fire. But this rapid fire is of a myth, myth question. So, are gynecological problems only about pregnancy and reproduction?
No.
Does a hysterectomy affect your long-term health?
No.
Is it bad to delay pregnancy until 30s and 40s?
In a way.
Do birth control pills cause weight gain?
Not now.
Is discomfort during intercourse normal as you get older?
That depends. It is a case-based scenario basically. There might be few pathologies or conditions where that age and that pathology might synchronize and give problem.
Okay. Can menopause be managed without medication?
Yes.
Does sexual health decline after menopause?
In a way.
Should women get a pap smear every year?
After 35.
Are there risks with vaginal aesthetic surgery? Because most of the people are opting for it nowadays.
In experience hand, no.
Okay. Thank you so much. And looking forward, let's get to another segment wherein we look at future of women's health and future of the hospitality or future of hospitals that we are going forward with. You've achieved so much already. What is the next for both professional and personally in your life?
Basically, my dream would be spreading Matrutvam hospital's idea all the districts of Maharashtra.
Okay.
Because I think in every other district, all the consultants and the gynecologists should come together. They should build a setup like this, and they should do a collaborative practice, and they should give patient the best service available.
So your vision is to have this where in Maharashtra or
To start with districts of Maharashtra, then we can think of expansion in all over India.
that's a great idea. And where do you see women's healthcare in the next 10 years, and what role would you play in the next 10 years that you think of?
100% we are on the move, and women's health sector is going to boom in next 10 years. And as a gynecologist and as a lady specialist, we would be playing a pivotal role in this.
Wonderful. What advice you would give to young doctors or entrepreneurs in the hospital field that would make a difference and would make them differentiate from any other?
I would like to suggest young doctors that they should make their priorities very clear. Do not consider your seniors and what they have done as a benchmark for your own. You should create your own benchmarks, and you should try to follow those goals. And you should not get involved in rat race.
So if you're not getting involved in a rat race, what would you prefer an ideal routine for anyone who is opting for this field would be?
I would say that all work, no fun should not be there. They should try to balance their work and family life nicely. I would like to suggest that.
And what is your routine as of now? Let's debunk success code of you.
I work hard. I do my laparoscopy as well as obstetric practice. Apart from that, I pursue a hobby where I do wildlife photography, and almost I have completed 2 documentaries in wildlife now. One is on Indian grey wolf, where they are on the verge of extinction. So hardly 3,000 of them are remaining in India. So I have completed my 4-year documentary on Indian grey wolf, and another documentary is on fan-throated lizard. That is a very unique and very beautiful lizard we find in western coast of
Maharashtra,
India. So those 2 documentaries, I wish they will be telecasted some or the other day on some channel.
So if you know any producers, please get in touch with Doctor. He has some of the best work that he has done in documenting these films, and of course it takes time, right?
It takes time, it takes patience, and you need to be very careful during shooting these documentaries, because you should not interfere their day-to-day activities
Absolutely.
and life. Yes.
Let's talk about some fun stuff as well, right?
Yes.
Let's talk about some adventure. What is the one place you have always wanted to visit that you're upcoming looking at?
Wildlife in Africa.
Wow.
Yes.
That's something interesting.
Yes.
And how do you recharge yourself after so many surgeries every day?
Spending time with my family, my wife, my kids, that is the best part. I am very much eager to go to home whenever I finish my work.
Any particular ritual or a spiritual thing that you follow every day, or a monthly or a weekly basis?
Basically, I try to teach my children our traditions and all the festivals which we have. I try to make them learn and what we say, आत्मसात करने.
So to understand, maybe.
To understand, I try to make them understand our
rituals, Indian rituals. I mean, we are heavily incorporated and surrounded with rituals.
Right.
And put next generation te kai karna rahe, I have no idea, but still you are doing a great job with kids. in the long term vision that you see on personal life, what is one achievement that you would like to have in your kitty?
To see Matrutvam grow all over India.
Wow, that's a big deal. Now let's talk about some takeaways and closing on some deals. So before Classic Cup and after Classic Cup, right? So before you even thought of coming to Classic Cup for the Matrutvam and having a multi-specialty women's hospital first time in India, what were your thoughts before and after?
Basically, I come from a two-tier city, that is Ahilyanagar. So the work scenario, the competition, the way of doing practice, and as I'm involved in health sector business, there are few limitations which we do not understand. Once you get associated with such a group of advertisement like Classic, so you understand the horizon, you understand that things can be scaled to a much
Higher
level, and sky is the limit.
Superb. Any one health tip that you would want to give to every woman listener out there?
I would say women should do muscle training exercises, and after 35 they should screen themselves for major cancers like breast and cervical cancers every year.
Let's talk about one word or two words that you would describe your life in some.
Basically, I have always used one tagline as my status and everywhere, that no risk, no gain.
So everything, the higher there is, the
Higher
better.
there is, higher the benefits. But comes very much pain with it. You should be ready for
The pain that
the
you are
pain
about
that-
to bear.
Yes.
That's a great. It was great having you on Decoded by Neel, decoding success of Dr. Pankaj Mate and his vision for women's multi-speciality hospital. Before you go, I had one thing asked you
Yes.
on what do you think about this?
So this is a picture man riding a horse. So this is very much a reflection of Classic advertisement, because once you board the Classic advertisement horse, then you ride so fast and so towards your goal that nothing is impossible. You can achieve everything with Classic.
Thank you so much for the kind words. It was great meeting
Thank
you.
you. Thank you.
And best of luck for your future.